I'm Dr. Daniels, and today we're going to be talking about the menstrual cycle and performance. This is going to be a brief overview, and I hope you find it helpful. A brief disclaimer, while I am a medical doctor, this is not medical advice. I am not part of your medical team, and I always recommend that you talk to your doctor and healthcare team before instituting any changes. The general outline of what we're going to cover, starting with what the menstrual cycle is, how it changes with time, what exactly is PMS and PMDD, and how it can affect your athletic performance. This is what the average menstrual cycle looks like. The cycle length starts at day 1 of bleeding, then goes to the last day before you start bleeding again. The period length is day 1 of bleeding until the last day of bleeding. Following the blue and green lines, you can see the changes in both estrogen and progesterone throughout the cycle as one increases and the other dips. There are other hormones that change as well throughout the cycle, but the estrogen and progesterone are the ones that most people know about. But it is these changes over the cycle that cause the symptoms that we'll be talking about today. We break up the cycle into general phases of the period, the follicular phase, ovulation, luteal phase, and the premenstrual phase. Now you can also hear this broken up into just general follicular and luteal phases, or you can even go as far as talking about the early follicular, late follicular, ovulatory, the early luteal, the mid-luteal, and the late luteal phases. It is important to know that this is the average length, which is 28 days. Some cycle lengths can be as short as 21 days or as long as 35. Anything shorter or longer is considered abnormal. We're not going to spend a lot of time delving into the world of abnormal cycles during this talk, but just have a general idea of what happens, how long, and where you are in this. Nothing is static over a lifespan, and a person's cycle and symptoms also change with age. Cunningham and their team looked at a huge data set of period tracker users with over 20,000 people. We won't get into potential pitfalls and nitty-gritty of the study, but let's look at how their users mark their symptoms and how it changed with age. The top graph looks at the average cycle length. And while we consider 28 days to be average, we can see that that time frame actually lengthens between the ages of 18 to 23. Then from between ages 23 to 45, we see a decrease in time with a sharp increase after 45 years old until 55. Below that, we look at the period bleeding days and see that they are actually the longest at the younger ages, and then that also decreases until 45, where it increases again. Now, around age 45, this is where you start to get into the perimenopause and menopause regions, and that's when we start to see a lot of variability. We're not going to get into this today, but please see our other presentation if you want to know more information. About 90% of people will have at least one symptom during their cycle, the average frequency of which can also change over time. Symptoms can include cramping, breast tenderness, body pain, headaches, and mood swings, just to name a few. The graphs look at the same symptoms in respondents broken up into age groups. You can see that the pattern is the same across the board, but there are still changes. Let's go over a couple highlights. For one, perimenopausal women that are between the ages of 47 to 55 have lower rates of bloating, nausea, and bad moods, and are found to have increased happy moods. A person in their 20s and 30s will likely see the highest rates of breast tenderness and fatigue. Cramps are more common in younger women, and they see a mild decline with age. Acne has a steep decline over time. And mood swings have a more what we call bimodal distribution, being seen more frequently in the younger and older population. Most people have some symptoms during their cycle. There's a subset that have more consistent and disruptive symptoms that, by definition, impair daily function or affect workers' school performance or interpersonal relationships. This is where PMS and PMD, which are premenstrual syndrome and disorder, fit in, which are the same thing, just different names. This affects somewhere between 20 to 40% of people with functioning ovaries. There's a long laundry list of possible symptoms that can occur, which can have either primarily physical, primarily emotional symptoms, or a mix of the two. Symptoms can include, but certainly not limited to, depression, mood swings, appetite changes, cravings, sleep changes, joint and muscle pain, breast tenderness and or swelling, feeling overwhelmed or out of control. This occurs in the luteal phase, which is the phase after ovulation and up to 14 days before bleeding, and then go away after the bleeding starts. Things are generally fine until the luteal phase comes back around. A big part of defining these disorders is that there is a symptom-free period of time. There are variants of PMS, but an important thing to rule out before getting this diagnosis are other causes, like unrecognized mental health issues, thyroid issues, and other diagnoses. One barrier I do want to highlight is premenstrual exacerbation, or PME. This is where other medical problems, like migraines or depression, can occur throughout the entire month, but peak in that luteal phase. This can take a controlled and managed issue and cause it to become unmanageable or just more difficult. Going beyond PMS, when symptoms are severe and affect your daily life when they occur and are either primarily emotional or a mix of emotional and physical, this is when you get PMDD, or premenstrual dysphoric disorder. This affects about 5% of people with ovaries. There are certain criteria that have to be met, but in general, symptoms have to be cyclic, severe, not due to PME or alternative diagnoses or medications, and have to have 5 of the 11 symptoms you see here. The causes are multifactorial, including genetics, serotonin, stress, inflammation, trauma. Ultimately, and what is interesting, is that the level of hormones in a cycle are pretty much the same between women, but how the brain perceives and responds is different. PMDD is not just feeling more moody or grumpy. Remember, it has to have severe disruptions, and it can have devastating outcomes. Those with PMDD are known to have thoughts of suicide to the point that 15% of people with this diagnosis have attempted suicide at one point. A full look at treatment options is beyond this talk, but options are available. Treatments for both PMS and PMDD are similar, but PMDD may need more interventions. But let's go through a couple of them. Knowledge. First is to recognize your symptoms. You have to start tracking. Any diagnosis will need data, so get a pen and paper or use one of the widely available tracking apps and be consistent. Then you're going to need help. You need to find a knowledgeable medical provider. You may already have one, but it is important to get established with someone you trust and feel comfortable talking to. Lifestyle recommendations, including regular exercise, physical activity, and a healthy diet, are first line. These can have wide-reaching positive changes and are highly encouraged. A talk therapist can make a huge difference in a person's life. Cognitive behavioral therapy, or CBT, has also shown to be very helpful. Now, before we start talking about the medications, I do want to state that any medications, supplements, or vitamins you think you may want to start should begin with a talk with your regular doctor, OB/GYN, or psychiatrist. But over-the-counter medicine may have some evidence behind it for supplementation with certain vitamins like B6, calcium, pepsid, or magnesium, which could be helpful. Prescription non-hormonal medications like SSRIs, think Prozac and Zoloft, with varying doses throughout the month may be beneficial as well. Hormonal medications like oral contraceptive pills can also be helpful. And finally, there are surgical options. PMDD can cause severe disruptions to a person's life. If you feel like this or the aforementioned PMS diagnoses may fit you, please start tracking your symptoms, your cycle, and make an appointment with your doctor. Before starting any medications or supplements, please talk to them. And no matter what, remember that treatment is available and you're not alone. Changing gears a little bit, let's focus on sports performance. Now, an athlete's performance is multifactorial. We can see changes based on how their body is functioning, the environment, including the weather, referees, location, or just how the athlete is feeling mentally and emotionally. But given the hormonal changes and symptoms seen over the course of the menstrual cycle and the well-deserved increased interest in women's sports, there's been more research done on how the menstrual cycle might actually affect performance in athletes. Let's take a look at some of this. This graph is similar to the one shown earlier, but broken up into the smaller, more defined phases, and also shows some of the other hormones that change with time. Some of the biggest issues with research done is that they don't all look at the same part of the cycle and don't all look at the same output measurements. Not to mention that the only consistent demographic studied is that a participant has ovaries. Otherwise, there's a big variability in age, baseline athletic status, and even primary sport. To give a couple of examples, one study looking at the difference between the early follicular, late follicular, and late luteal didn't show any difference in vertical jump, hand grip strength, or 20-meter running time. Another looked at non-professional runners and noted they documented their best marathon times during the luteal phase as compared to the follicular phase. In 2026, Cetronesta looked at day 2 versus day 5 of the early follicular phase and the late luteal phase, noting a decrease in 1,500-meter running time at day 5 over day 2. There are many, many more studies done, but because of the aforementioned limitations, it can be really difficult to paint a specific population-level picture based on objective findings. Carmichael et al. In 2021 tried to do just that and concluded that there really wasn't a clear significant change in objective performance, power, strength, anaerobic, or performance based strictly on the menstrual cycle. But maybe there's a small trend toward decreased strength towards just before and during the actual bleeding process. Being said, we're talking about performance, not hand grip strength. Importantly, over half of athletes tested said they felt like their performance was altered based on their cycle, with the worst in the early follicular and late luteal phases, aligning with just before and during bleeding, along with the associated symptoms that accompany this. Now, motivation did seem to increase in the ovulatory phase, which can also influence performance. Unsurprisingly, there's not much casual on-the-field conversation around menstrual cycles or conversations between athletes and their coaching staff. Younger athletes are more susceptible to concerns about social stigma and flooding, which is just leaking. These can act as distraction and also change performance. This can be made worse if they have to wear white uniforms or if there are environmental challenges such as bathrooms being far away or not even available. With all this in mind, the mental and emotional changes that can occur with the menstrual cycle has been shown to affect training, as practices and sessions had to be changed for somewhere between 27 and 66% of athletes. So, does a person's menstrual cycle affect their performance? Maybe. We have to look at performance from a holistic perspective, not just from a hard science point of view. References used throughout the presentation, I would always recommend looking them up if you have any specific interests. Having covered these topics, I hope you got something out of this. I want to leave you with my few big take-home messages. First, it's important to know yourself, your body, your symptoms, and your life. So start tracking every month. Do what you can to optimize your life as best you can. And finally, talk. Talk to your coaches, your friends, your doctors. Talk about your struggles. Talk about what's helped and where you need help. And remember, you're not alone. Thank you.